Hello, I'm Dr. David Hornbrook, the Clinical Director of Education and Technology here at Kdz Dental Arts in Irvine, California. Kdz is a full-service lab, and we're very excited about all the very cool things we're doing here at Kdz Dental Arts. Today I want to talk to you about the fastest growing restoration in indirect dentistry, and that's the Zirconia oxide crown. Now here at Kdz Dental Arts, we offer basically three products in this category of zirconia. The first one is what we call the KDZ Bruxer. And this is a monolithic crown that typically we would use in the posterior in molars. Now, the interesting thing about the KDZ Bruxer, it's the strongest restoration we have. The flexural strength, and that's basically represents the durability of the ceramic. The flexural strength of the Bruxer is about 1200 megapascals. Now, to give you a reference what that means, it is comparing it to a PFM. The porcelain on every PFM you've ever done or will ever do, it has a flexural strength of 100 megapascals. So theoretically, durability and the strength of a KDZ Bruxer is 10 to 12 times stronger than that of a PFM, especially in areas that undergo stress. That would be marginal ridges, functional cusp, central fossa, 10 to 12 times stronger. Now the KDZ Bruxer, typically we only use it for second or first molars primarily because it's a little bit opaque. I probably would not use it in the anterior. There's better materials that I'll talk about, but it is the strongest. So when we're looking at second molars, where it's closer to the hinge axis, more stress, the KDZ Bruxer is excellent for that. And you can cement it with anything you want. You could temporarily cement it, you can bond it into place on short preps, you could use a resin ionomer, you could use a glass ionomer, I mean, whatever you prefer. Because of the strength, we can cement it with anything. That's the KDZ Bruxer. So molars, both mandibular and maxillary molars, or as a framework for a multi-unit bridge in the posterior. We can actually do full span 14-unit bridges if we wanted to out of this material. But 4 or 5-unit bridges in the posterior, excellent for this material because it's tooth colored and it's strong. And the fit is excellent because it utilizes CAD/CAM throughout the entire process. So that's the KDZ Bruxer. The second material in this category of zirconia is what we call the KDZ Bruxer Aesthetic. Now this is a relatively new material in dentistry. It has the strength of zirconia, but the aesthetics that we see with lithium disilicate or even the glass reinforced ceramics. Now the aesthetic, again, typically we would do single crowns, but not only posterior like we saw with the Bruxer, because the translucency, a generic term for this would be HT zirconia or high translucency. The aesthetics rival that of most of our other ceramic systems. So we could use it for an anterior crown. We can use it for a 3-unit anterior bridge. I use this a lot for single crowns because the flexural strength, as I mentioned before, where a PFM, the porcelain has a flexural strength of 100. This material has a flexural strength of 650 megapascal. So you see, we're 5 to 6 times stronger than that of a porcelain fused to metal crown. Again, areas that are undergoing stress, that would be marginal ridges, central fossa, functional cusp. Also, this is almost twice the strength that we see with lithium disilicate, which has become kind of a mainstay for single crowns in the posterior. We have a material that rivals its aesthetic value, yet is significantly stronger. And this all is fabricated under CAD/CAM, so the accuracy is very good. Cost is unbelievably low compared to some of our lithium disilicate systems. Excellent system. Single crowns, we're not going to do any bridges with this except in the anterior, 3 units. Or we can do anterior crowns. I wouldn't do veneers with this material just because the bondability is not as high as we see with some of our other ceramics. The third product is what we call the KDZ Ultra. Now this material still utilizes zirconium oxide, but only as a framework. So we could have, just like a PFM, we could have a coping, but instead of being metal, it would be zirconia, relatively translucent at this thinness. And then we overlay with beautiful ceramic. So this is the Ultra. The advantage of this, we're going to get aesthetics that have the depth that we see with some of our beautiful restorations that are layered in multiple layers. Where do I like to use this? In the anterior, multiple unit bridges. As I mentioned earlier, the KDZ Bruxer aesthetic can only be used with a 3-unit bridge. If I was going to do a bridge, let's say from K9 to K9, 6 units, I would use Kdz Ultra. The zirconium becomes the framework because the flexural strength of this framework in the Ultra is approximately 1200 megapascals. You will not break that. The thinness makes it relatively translucent, certainly not the ugly metal that we see with the PFM. And we can overlay with all this cool material. Again, this can be a 10-unit bridge if we needed to. I've done lots of 6- and 7-unit bridges utilizing Kdz Ultra. The other cool thing about Kdz Ultra is you can design the framework, or we can at the dental lab because of CAD/CAM technology, pretty much any way you want. Let's say we have a mandibular premolar. That's part of the aesthetic. Could be a maxillary premolar, part of the aesthetic zone. We would like something to be aesthetic as possible and as strong as possible. Or maybe this premolar is an abutment of a 4-unit bridge. So we have to use a relatively opaque zirconia. We want optimal aesthetics. This is the facial or the buccal. We want optimal aesthetics, but we need maximum strength for the connector or certainly the central fossa, any functional cusp. What we can do is we can actually, and this is again done through CAD/CAM, we would design this restoration so that this would be our Bruxer material, strongest material we have, 1200. And then we overlay with this beautiful, and we use Noritake, which I think is the most beautiful ceramic to overlay any zirconia. In the aesthetic area, or the aesthetic zone, this becomes this beautiful layered ceramic. So we get the advantage of beautiful aesthetics that would certainly rival our lithium disilicate or our glass lucite reinforced ceramic, and we get the strength of zirconia. So hopefully that certainly answers some of the questions you may have, or certainly eliminate some of your confusion with some of our zirconia materials. If you're ever in the Southern California area, Keating Dental Arts is in Irvine, California, about 5 miles from Disneyland, 5 miles from Newport Beach. We'd love to have you stop by.